Okay, so welcome to this fast Spanish class. We're gonna try to keep this class under 5 minutes. So I hope this works. I'm gonna try to teach you how to say hello to your patient, how to introduce yourself so you can get the conversation going in the fastest way possible. So let's try it out. Now, some of you may know the informal ways of saying hello, like buenos dias, buenas tardes, buenas noches, but in a clinical setting, you want to be more formal. So I'm gonna give you here a formula that you can use as soon as you enter your patient's room, how to say hello, how to introduce yourself, and how to get the conversation rolling. So this is what I would use if I was you, a provider, either a nurse or a doctor. You can enter the room and raise your hand and say, hola, mucho gusto, soy su, and then insert your title, and then say your name. So just to give you an example, let's say you're a doctor and you're Dr. Smith. You can enter the room saying, hola, mucho gusto, soy su doctor, Dr. Smith. Just to give you an example. But if you're a nurse, you can say enfermero or enfermera, doctor or doctora, and then you can just throw in your name at the end. Of course, you can also use what most people use and say, mi nombre es Doctora Smith, mucho gusto. But I feel like this formula that I'm giving you gets the conversation rolling a lot faster and it's a lot smoother. So give it a shot. After this formula, after this quick introduction of yours, the patient will most likely say, mucho gusto, doctor, or mucho gusto, enfermero, or enfermera, or whatever your title is. And you can then close the introduction by saying, encantado if you're male, or encantada if you're a female. That closes the introduction window, and you can proceed to, with the consult, with the actual medical problem. Now, after you've closed the introduction window, like I mentioned, you can follow up with ¿Cómo le puedo ayudar? How can I help you? ¿Cómo le puedo ayudar? And here, let me give you a quick cultural tip. I know you understand what señor and señora is. We use señor for sir and señora for madam. But we also use other terms. We also use señorita, which is young lady or young woman. Don is used for men and doña is used for women. So if the patient's name is Juan and it's a male, you can say Don Juan. If you have a patient that's a female and her name is Maria, you can say Doña Maria. So you can even say, ¿Cómo le puedo ayudar, Don Juan? ¿Cómo le puedo ayudar, Doña Maria? It's very respectful and it's customary to use in the healthcare setting. So you're not doing anything wrong if you want to go that route. So again, you introduce yourself with the formula that I just gave you, and then you quickly jump into ¿Cómo le puedo ayudar, Don or Doña, or Señor, Señora, or Señorita if you have a much younger patient. Only for women though. Don't use it for males. Just use their name. So again, just to recap, you're going to enter the room, you're going to raise your hand, and you're going to say, hola, mucho gusto, soy su doctor, Dr. Smith. And then the patient might say, mucho gusto, doctor. And then you can follow up with, ¿Cómo le puedo ayudar, Don Juan? And then they will start telling you their history, their complaint. Now, this is when you first meet someone though. What happens if it's a follow-up or you already know the person? You can just walk in and say, hola, ¿cómo ha estado? And then introduce their name. So you can say, hola, ¿cómo ha estado, señor Juan? Or Don Juan, if you know the patient already and you've seen them before. But anyways, this is just a quick little formula that I feel gets the conversation going a lot smoother, a lot faster, and it's definitely helpful if you work in a healthcare setting where it's fast-paced. Hope it helps.